Certainly the Ismaili community in Canada has made the most of the opportunities which all people who come to this country have. That is the reason why I think people understand once they get here that their lives are going to be different. And that's one of the interesting things too about what you talk about to the Jamaat, the community. And I think something that people should realize in the rest of Canada, that you have your community and it's very important, but that you emphasize how important it is to be part of the world outside your community. And why do you do that?
Well, I have to go back to 1957. In 1957, many of the countries where my community was living were colonies. And those countries needed to go through the process of independence, needed to find the pathways forwards towards peace, towards development. And I've asked myself, how do countries achieve that? And if you go back to 1957, you look at the map of our world and you try to define where all these countries that have now become independent have created opportunity. I think one has to say that that has not been very successful.
What have been the barriers? What are the barriers?
Oh, I think there's a multitude of barriers. First of all, I suppose natural resources would be a major issue. The second would be the level of human ability within a given country, whether it has the human ability to develop its resources, to build opportunity. So in that sense, we're looking at processes of change, and they have occurred. They have occurred. There are today countries of opportunity which either didn't exist or one wouldn't have thought of as being countries of opportunity in 1957 when my grandfather died.
And that's changed.
That's changed.
Well, you have had a lifetime of opportunity to see that. It's very rare to meet somebody who's had such an effect on the world, not only on a group of people, but in the world, because that's what you've made it, in 60 years. Next year will be your 60th anniversary as Imam. And in 60 years, you have seen development, you have made development happen, you have made resources available to places where there were absolutely no resources. And in doing that, it can't have been easy to decide where that would happen, to decide who would be the collaborators, to bring along people who could understand and have the capacity to help with that development. How did you go about doing that?
I think what you try to do is look at circumstances on an ongoing basis, and then you work through what I would call predictability. And you try to project into the future what countries have the ability to follow the path of peace and development, and where there are situations which are potentially difficult. And that, of course, is something which changes practically every day. And, of course, it's changed a lot since 1957.
And they didn't teach you that at Harvard.
I'm not sure what they taught me at Harvard.
Yalimalat, welcome, bienvenue. My name is Khalil Shariff, and I'm coming to you this evening from Ottawa, where I've crashed the studios of Friday Night Reflections and taken over the show on behalf of Aga Khan Foundation Canada. As Chief Executive Officer of AKFC, it is an absolute delight to be hosting this evening. To be honest, it's something I've been waiting months to do. But when no invitation was forthcoming, I've had to muscle my way in. And I'm really happy to have done it for this episode, because tonight we're going to be celebrating a theme that is near and dear to my heart. And I know it's near and dear to the hearts of so many people watching. Our theme tonight is celebrating the World Partnership Walk. Its past, its present, and all the work around the world that it has enabled. Aga Khan Foundation Canada is commemorating its 40th anniversary this year. Over those 4 decades, AKFC has worked closely with our partners in the Aga Khan Development Network to invest in sustainable and meaningful change in the quality of life of some of the most marginalized communities in Africa and Asia. And during this time, we've built deep roots here in Canada. We've created award-winning programs to raise awareness about development issues among Canadians. We've architected agenda-setting partnerships with Canadian institutions to leverage expertise in support of our programs. We've created opportunities for young people to get exposed to some of the cutting-edge issues in development. And of course, we have enlisted the support of thousands and thousands of Canadians from across this country to fuel and finance our work. 35 years ago, a group of women leaders from the Jamaat came together to create a platform to kind of give back to the countries in Africa and Asia from where they had come. That first World Partnership Walk attracted a few hundred people and raised $55,000. Now, 35 years later, the World Partnership Walk is a national institution. In 10 cities across the country, it has raised over $120 million. And more importantly than the number of dollars is the impact that it has had, supporting 180 initiatives across 15 countries, creating incredible change in the lives of millions of people, building permanent institutions that will serve these societies for generations, and creating bridges of values, of knowledge, and of support between Canada and the rest of the world. The World Partnership Walk has become an incredible national institution and movement, the largest of its kind in the country. But of course, this year, there was no World Partnership Walk. Stanley Park and Metro Centre in Toronto were silent on the last Sunday in May for the first time in 3.5 decades. The parks in Victoria and in Edmonton and Calgary, in Saskatoon and Regina, in Kitchener, in London, in Montreal, did not host our families, our friends, our co-workers and our colleagues. With samosas in one hand and a mango lassi in the other, we were not able to come together to contribute to a more peaceful, prosperous, and pluralist world for all. That was a real disappointment. It was a disappointment for me personally. I know it was a disappointment for so many of our volunteer leaders across the country. It was a disappointment to many of our donors who have indicated to us since then, despite all the economic fragilities that the country here is facing, how much they're ready to contribute to the fragilities around the world. So today, I'm delighted to announce that we will be having a World Partnership Walk this year, but it'll be a virtual walk. Starting October 27th and going for 6 weeks, we're going to take people on a virtual voyage around the world to see some of the countries in which we work, the impact we've had, and our plans for the future. On December 6th, we will culminate with a virtual online homecoming event where we'll celebrate the contributions that Canadians have made to building these bridges at such a difficult time in the world. Over that 6-week period, we're going to be inviting all of you to register. reach out to your friends and colleagues to raise support for the work of the Aga Khan Development Network, to form a team at work or in your neighborhoods, and find a way to express your commitment in our effort to create a better life for all. Now, more on that on our virtual voyage to come later in the show. But first, we're going to start with a conversation I had earlier this week with two extraordinary colleagues of mine at AKF. Tinni Sawhney is the Chief Executive Officer of Aga Khan Foundation, India. She brings to the role 25 years of experience in development, including at the front lines of rural India, working on agriculture and livestock issues among smallholder farmers. She was the Director of Programs at Aga Khan Foundation India and is now the Chief Executive Officer and is an extraordinary leader for us at AKF, but an extraordinary development leader in India more generally. And Dr. Claudia Hudspeth is AKF's Global Lead for Health. Claudia is a fellow Canadian, a physician by training and a public health expert who has worked for years with some of the most important global health institutions in the World Health Organization, UNICEF, and of course, even brings a history with the Aga Khan Health Service. We're really delighted and fortunate that she is serving at AKF at this important public health moment in our history. And I had a conversation with the two of them about the COVID crisis, how it's unfolding in all of our program countries, and how we're going to respond both immediately and in the months and years to come. After that, we'll have a segment called On the Walk, where we will remember some of our favorite walk experiences over the years and talk a bit about how we're going to adapt to a virtual walk this year. And we'll end with a sneak preview of our virtual voyage around the world before ending with a beautiful musical finale. So I want to thank the Jamaati leadership and the council for allowing AKFC to share some of these ideas and thoughts and programs with you this evening. Grab your chai and your naan katai. I've also been waiting 8 months to say that. So grab your chai and naan katai, sit back, and enjoy this week's Friday Night Reflections. Tinni, Claudia, thank you so much for agreeing to join us for this conversation at this difficult time. Tinni, let's start with you in India. Tell us a little bit about the current situation of the COVID crisis in the country. What's the current state of things?
So in India, we do have numbers that are rising. The current statistics are around 7.6 million COVID cases across the country. But given the total number of the population, that is a small, it's not such a huge number given the size of our population. We also have a very high recovery rate. Currently, it's almost 89%. And I think one positive thing that we have witnessed over the last few weeks has been a steady decline in the daily numbers. However, that said, there have also been newspaper reports very recently saying that perhaps India has reached its peak and we will see a decline going forward. There was a newspaper report just today that spoke about almost 30% of the population already having antibodies. However, we are moving into the festive season. This is the current time of what we call the puja celebrations across India. And this is the time when many people go to markets for shopping and things like that. And about 3 weeks later, we will have our festival of Diwali. And therefore, there is need for utmost caution at this point of time in terms of adhering to all the precautions. We had our Prime Minister speak to the nation this evening, and he also reiterated the need to adhere to all the COVID-19 precautions, particularly around physical distancing. So yes, the situation is worrying in terms of the increase in the numbers and a certain fatigue setting in among the population, and therefore a laxity in terms of wearing of face masks and physical distancing. So I think the importance for us is to continue to reinforce these messages.
Claudia, India is clearly one of the places where AKF and the AKDN have a presence, but we are present in many other geographies. Tell us a little bit about how the COVID virus is faring in other parts of the world where we are present.
Thanks, Khalil. I think probably many people were very concerned at the very beginning, where we saw numbers really rising and we didn't see how that would trend over time. And I think we had the first wave and numbers certainly went up, and AKDN were able to put systems in place and scale up testing and scale up access to care and treatment. And so following that, we've actually seen the numbers decline following the initial peak in many of the other areas, unlike the situation in India, obviously. So in Pakistan, we've seen a flattening of the curve to a certain degree, and in Afghanistan and East Africa, very similar. I think part of the, a little bit of the surprise to us has been that we saw a spike in cases, but the decline, and like many other countries that are starting to reopen their economy and get kids back in school again, we're starting to see a rise of cases again, but not at the level of the steepness of the curve that you're seeing in some other parts of the world. And so that's a little bit surprising to us, but probably something related to underlying protection of the communities in terms of their disease profile, and also, precautions that have been put in place, and perhaps even some immunity that exists within the community itself. And so it hasn't been as severe in some of the areas as we expected, but it's still having a significant impact on those populations.
And Claudia, can you say a little bit about, from the health perspective, how we have sought to respond across all the geographies where we're present? What have been the key priorities to deal with this as a health crisis?
Sure. No, I mean, I think initially we were very quick as AKDN to put in a response framework in place that guided the response across all of our programmatic countries. And the response was really centered around three pillars. The first pillar has been around preventing transmission, suppressing spread, and preventing outbreaks. And that's been a big focus, as Tinni was mentioning, on hand washing, on physical distancing, on wearing of masks and prevention, and also protecting the most vulnerable populations, especially within the Jamaat, where we have a number of aging populations, and we have folks who are extremely vulnerable to any sort of respiratory illness. So we've been very cautious with that population to help prevent transmission in that group and protect that group. The second pillar has been around treatment, access to care and treatment, as well as case containment and testing. So scaling up the testing availability, supporting government and AKDN systems on contact tracing and surveillance, protecting our health workers from infection, and then ensuring people have access to care and have the absolute best quality of care where they're situated. So we've done a lot of work to set up field hospitals and improve the capacity of inpatient, including intensive care units in some of the remotest parts of the world. And then the third pillar, which I think is probably becoming much more important in the long-term response, is really looking at mitigating the impact of the response to the pandemic on broader systems. So as you can imagine, as was the case in Canada, where we have lockdowns or we have an impact on the economic situation of the country, there's an implication for communities. And so we've been focusing on how to support parents who have children at home who are learning, and children who need to still progress in terms of development milestones and interact. And so we've been supporting early childhood development and homeschooling. We've been supporting things like livelihoods, small businesses, and the food security situation, and doing quite a lot of work on ensuring that certain elements of our populations are protected. So I think that third pillar around long-term protection and system protection beyond the health sector has been incredibly important and will be important going forward.
Thanks, Claudia. Let me bring Tinni back in here. Tinni, can you say a bit about what has been the actual response that AKF and the AKDN has been able to mount in India? Can you give us a couple of examples of ways in which you've had to pivot your programs in light of the crisis and the needs that have emerged in the immediate term?
So, I mean, the three pillars of our COVID-19 response that Claudia mentioned. So, immediately when the crisis started, when we had when the lockdown was enforced, which was towards the end of March, the first priority for us was how do we were not able to really visit our program areas. So, how would we understand how our communities were actually faring? So, one of the first activities that we actually did was to launch a phone survey to actually understand what are the challenges, what are the immediate challenges that our communities are facing across our geographies, and therefore how do we respond. That phone survey actually brought out a lot of findings which guided our subsequent COVID-19 response. I mean, one of the first things was that access to basic PPE like face masks was not there in the community, and also the awareness around the protocols that needed to be followed. So those were some of the initial activities that we actually started. We got our women's groups, our savings platforms. So these are actually women's savings and credit groups, and we got them to start stitching face masks as an immediate response. And over time, that has also become a source of income for these women. Also, we found that frontline workers who actually were required to go into the communities and actually explain about the precautions, they also needed basic PPE. So those face masks actually came in very handy in that area. The protocols around hand washing. So in the villages that we work in, for example, there are shared water hand points, and we then put in place protocols around maintaining physical distancing at these shared facilities. The government had announced a slew of relief measures, including the distribution of food rations for the most vulnerable. So getting that information across to the communities. So we used the phones that we had. Our community representatives visited the villages. We used loudspeakers to build awareness around the various schemes that the government had announced. Schools and ECD centers were also closed during this time. So we also used WhatsApp messaging to develop a series of posters around early childhood development approaches and parenting tips that we shared with parents, engaging games that they could play with their children. So across the various thematic sectors, we actually were able to respond quite effectively across our geographies. And AKDN came together on this effort, and we were able to provide the immediate support that our communities needed across our geographies.
Tinni, there's been quite a lot written about how the health consequences and the broader consequences of COVID have fallen disproportionately on some groups, especially on women and girls. Are you seeing this in India? Can you say a little bit about maybe the differential impact of the crisis on women and girls in India?
So I think one thing that we will see going forward is that there has been girls have not gone to school for all of these months. And particularly those who are at a certain age where their parents might want to see them married, we're currently struggling with this issue that when schools do reopen, how do we really motivate parents to actually send their girl children to school as they used to do earlier, given that there will be an immense gap in their school year. So I think that has been a challenge. Also, given that women and girls in communities are often what we call the marginalized among the marginalized, in times of crisis when food rations are limited, it is women and girls who perhaps have had less food rations. And also in times when communities are going through stress, often that stress is taken out on women and girls. So in our communities, we also did track issues around, whether there has been an increase in any kind of violence against girls and women. So those have also been activities we've used our community cadres to continue to pass on information around the law and also support women in that crisis. also widows. I mean, at times when, say, the government was distributing rations, widows did find it difficult to really reach these centers. So then, say, our women's self-help group platforms actually identified who were the single women, the widows, the elderly in these areas who needed special support. So I think that we've been able to use very effectively the very strong foundation of community institutions that we had in these areas to be effectively able to respond, and to also respond in particular to the needs of the most vulnerable. So I think that has been a positive. We've also seen community institutions go out of their way to ensure that, say, their members who were among the most vulnerable were able to get access to food rations and other entitlements.
Claudia, let's talk a bit about the longer term here. I mean, the immediate crisis has been obviously serious and has required the kinds of responses that you both have talked about. Can you look to the future a bit? I mean, what do you see coming down the road on this? Is there, are we going to return to a pre-COVID normal? Are we going to see, even just in the health system, may we start? I mean, are we going to see long-lasting consequences of this crisis on the health of our populations and the health systems?
So thanks, Khalil. I think it's not whether we're going to, we are seeing already quite a serious impact on the health systems. I mean, if we just bring it to Canada, if just look at the Canadian situation, how many people saw emergency wait times really drop in Canada because people were not coming to the health system. And it's the same in the programmatic countries where AKDN works, where people were just not coming to facilities for things that are not only emergent, but things that are preventative as well. And we're seeing serious drops in things like, child well-being checks and childhood vaccination coverage, and on services that around birthing and delivery. And so we're seeing we're anticipating seeing, it's hard to see it right now, but a serious rise in child death rates and maternal death rates in the countries. In fact, there was some modeling done early in the pandemic that thought that within the first 6 months of the pandemic, we would see excess of 250,000 deaths of under 5 children just due to COVID impact on the health system alone. And the upper end of that estimate was just over 1 million additional deaths of under 5 children globally because of the impact of COVID on the health system.
And just to be clear, Claudia, what you're saying is that that COVID has prevented a bunch of things that we have come to count on, and these families count on in terms of outreach and support and antenatal care and vaccinations that we count on for maternal and child health and survival.
Exactly. I mean, most of the systems that we put in place in developing countries are very much focused on preventative care. So like you say, pregnant women come in for regular checks, at least 4 visits and up to 8 visits during their pregnancy. A lot of those visits are either not happening, or the outreach service that people rely on, where the nurses and midwives come into their community, are also not happening, because we're both preventing transmission in our health workforce by reducing contact. I mean, almost all of the gains that we had made over the last 10 or 15 years are being reversed. We're seeing in the last month, I would say, we're seeing some improvement in that trajectory and some reversal. So we're now kind of trying to get back up again in terms of our vaccination numbers, and we're starting to see people come back to facilities and start to use the services that are so critical to reduce some of the morbidity and mortality rates. And so hopefully we'll start to reverse those losses and improve.
Tinni, presumably this crisis is become now an educational crisis. It's become an economic crisis. Look forward for us over the next kind of 3 to 5 years. What do you see as kind of being the most important, long-lasting, non-health consequences of what we're going through in India?
So I think, if we just go into the genesis of a coronavirus, how did it happen? I think issues around the environment, how we interact with the environment, and how we really center stage the concept of One Health. I think that's going to be something that is going to be very important for us, and something for us to really put into our programming. Healthy environments, healthy livestock, healthy humans, and all of those linkages. Because across our work, there is so much dependence of us on the environment. So how do we really protect the environment and ensure that we are not adversely leading to that tipping point in terms of environmental degradation. So I think issues of climate change, of environmental regeneration are going to be very important going forward, and the interlinkages between environments, the livelihoods that we follow, and our own health. I think that's going to be very important, and something definitely for us to keep in mind in our programming. Also in terms of education, the whole digital process, there's been a lot of focus on using digital platforms to actually reach children, to reach those who are unreached. But whatever it is, we are going to see some people who will not be able to access digital platforms. So how do we really reach them as well? In the states that we work in, migrant remittances are a very important part of household income. So we also had a large number of migrants who actually returned back to their villages because of the lockdown. There were no jobs in the cities that they'd gone to. So another idea that is assuming importance is how do we create more job opportunities closer to where people actually live? So do they really need to go so far in search of work? Can we bring processing facilities closer to production centers? Like say in some of our areas where a lot of tomatoes grow, can we bring in processing facilities there and create jobs much more in the local area? So I think that's another thing that particularly from our context is something that is quite important. But I think these months, just related also to what Claudia said, have also seen a lot of innovation, have seen a lot of people stretching themselves beyond their comfort to really reach out to communities. So I think those would be some of the aspects that we will need to keep in mind going forward.
I wonder if we might end with a bit of a personal reflection, Tinni. I mean, this is what a time to be in a position of responsibility and leadership in development. Can you say a bit about how has this felt personally as a leader in India tackling these issues? Can you say a bit about I guess your own personal journey and how you feel that maybe AKF and your role is kind of well positioned to now to deal with the challenges you've enumerated in the future?
So I mean, just reflecting back and, the COVID-19 pandemic, I remembered just before the lockdown happened, I was actually traveling to one of our states, and on the way back, we heard that perhaps at airports there would be some sort of screening and things like that. But we felt it wasn't something that would stay for so long, that, this whole working from home would almost become, a pattern. We'd never really faced that. I mean, going to the office was such a part of our routine, and then having to move to say meetings on your laptop all the time, and just trying to ensure that our COVID-19 response was happening. We'd given a commitment to our national committee here that no household in our geographies would go hungry. And really happy to say that our team was very careful to adhere to that commitment that we had made. So across our geographies, we were able to ensure that no family actually did not have access to food. So I think it was keeping in touch with the team remotely on a regular basis. That initially was a challenge. We were not very used to this way of working. And then gradually, as things opened up, ensuring that all of our offices maintained the protocols that were required, that we kept track of all of our staff when they were going into the field and returning. So I think those were some of the challenges. Also, where our team members did contract the disease, what was the support that we could provide to them? What was the reassurance that we could give to their families? I think that was something very important. So I think as a team, we have come through this much stronger. There's a much stronger reaching out as well. And I mean, they always say that in difficult times, you do tend to come closer. And I've really seen that happen with our team here, with other colleagues at AKDN. So there was a lot of sharing with other AKDN institutions as well. How are you happening? So there were many calls that we did have. So I think that has been something that, we have all felt. I mean, in terms of my own personal journey, I mean, working in development was not something that I had initially planned. So I've done my graduation in economics, and I was set to say, all right, do my master's in business administration. But I then joined an institute which is known for its work on rural management, and it was the first stint where I actually had to go out and live in a village for almost 2 months. That really changed my mindset, made me understand the situation in our villages much better. And I think that's when I decided that this was something that I really wanted to do. I joined AKF in 2002, and it's been a wonderful journey since then. I initially joined as on the rural development program, and gradually moved then to other responsibilities. So I think working at AKF has also helped me contribute in whatever measure to some change at the grassroots, and that's very what I'd say motivating. I mean, when you can see that change happening, that's very motivating, and in fact keeps many of us going.
Claudia, you have been at the center of architecting AKF and the AKDN's response to the crisis. In a sense, it's a bit full circle for you in your career. Tell us a bit about how you're reflecting on your own personal journey as it's brought you to kind of confronting this crisis so clearly.
Thanks, Khalil. I think it's been an amazing journey. I started with AKDN back in 2000, actually 20 years ago, and I was a fellow. I was a International Development Management Fellow with AKFC, and I spent almost a year living up in Gilgit and Chitral through the winter, and in pretty tough conditions, I would say, and got to know the health system. I worked with AKHS in rolling out the integrated management of childhood illness program, and got to know the system very well, the primary care system that's been so critical, and got to know many of the staff up there, many of the valleys and communities, and just how difficult it is to program in those areas. And so I feel like now 20 years later, many of the staff are still there, and just having that in-depth knowledge about the landscape, the communities that we work in, not only in Pakistan, but also Afghanistan, Tajikistan, and East Africa, has really given me such insight into what's possible in the network and just how much impact that we can have. And I think for me, one of the most beautiful parts of the response to this pandemic, of course, any pandemic would test anybody's system, no matter how perfect the system is. There's always going to be cracks. But the thing that's been just incredible for me is to see AKDN really come together as a whole, all the sectors. And COVID, as we know, the response is not just reliant on the health sector. We're looking at teachers and schools and civil society organizations and the savings groups and the economic aspect of things and the Jamaati institutions that have been so critical to getting the word out. And it's just been absolutely amazing to see people coming together and aligning all the efforts around the response framework and and just seeing the magnitude and power of the AKDN brought together in one holistic response effort. It's just been absolutely incredible. So I'm very grateful. I mean, it's been an amazing journey. I started 20 years ago. I didn't stay with AKDN all those 20 years. I worked with the UN, with UNICEF. I worked with World Health Organization and other actors. And I found my way back to AKDN in 2017. And so it's been both a culmination of 20 years of my career, but also I've been in AKDN again now for 3 years in this last effort, and it's been absolutely amazing to see the organization really step up and be able to respond to the pandemic in a very holistic way.
No, thanks so much, Khalil, for having us on the show. We really enjoyed all the questions and responding, and this opportunity to share some of the work that we've done. But you've been asking us all the questions, Khalil. So could I just ask you a question as well?
Sure.
Yeah. So Khalil, could you tell us a little bit about your journey at AKF and the work that you've been doing? You've been such a fabulous leader, someone we look up to. It's always amazing to hear you. So just tell us a little bit about your journey, Khalil.
Oh, Tinni, well, look, thank you. That's very generous. I have to say, like the both of you, I mean, I think the COVID crisis has come to us unexpectedly and has challenged all of us in such incredible ways. I think, I've been now with AKF for 15 years. And one of my big reflections over the last 6 months, like I think both of you have suggested, is the incredible way in which the entire system, the entire Aga Khan Development Network system has come together with such focus and with such commonality of purpose. And that's been very inspiring. It's also been extraordinary to see how many people, individuals and institutions have come forward, even at a time when it has been so economically difficult in this part of the world, who have stepped up with openness, with generosity, with extraordinarily big hearts to figure out ways and ask for ways in which they can contribute to a global response. And I think that's been very inspiring for me. And in a sense, it's been something that has reminded me of one of the great principles of work that I realized very early on when I joined AKF, which is this idea that we're all in this together. The extraordinary interdependence of our world. I mean, the thing that compelled me to come to join AKFC 15 years ago was His Highness's extraordinary vision that we are living in a time of deep interdependence, and that we had to act on the understanding of that interdependence by actually contributing to each other, by, as he said, building bridges that unite to replace walls that divide. And if the COVID crisis has reminded me of one thing, it is that our interdependence is more true today than it has ever been. And our ability now to come together, not only in our cities and in our provinces and in our countries, but indeed around the world, is going to be what will bring us out of this crisis with a sense of hope and optimism and confidence in the future. And I do think that the Aga Khan development institutions are ready and best beautifully positioned to do this with the support of all the people who have been contributing and providing so much support to us over the years.
Thank you so much for that, Khalil. I mean, that was so beautifully said. I mean, those bridges, that's what's going to get us out of this situation, and just being able to depend on each other. I think so. Thanks so much. Another very inspiring message, Khalil. So thanks so much for that.
Tinni, Claudia, thank you. Thank you so much for the leadership that you are both exercising on behalf of AKDN in the service of all the communities and people who we exist to serve at this very, very difficult moment. And thank you also for your time and sharing your wisdom and your insight with us this evening. We are sending lots of wishes and prayers for your continued success in this important effort, as you have said, in the immediate wake of this situation, but also over the coming months and years as we work to support our communities to build back in a stronger and more resilient way in the time ahead. So thank you both for joining us tonight. What a great conversation with Claudia and Tinni. Thanks to them both for sharing their wisdom and their insights with us this evening. Let's now hear from some of your favorite memories of walks from the years past and how you plan on participating virtually this year.
My name is Ryan. And I'm Kyle. We live in Edmonton. We've been participating since we were born.
I remember participating in walks as a family with my 2 young daughters in a double stroller in the late 80s.
This is Arya, and she's my walking buddy for the day of the walk. Every year, she comes out with us.
My journey or connection, I would say, with Walk Partnership Walk I would say, came much earlier in the form of Aga Khan Foundation. Myself, having come from Afghanistan and spending my childhood in Afghanistan, growing up for a couple of years in Pakistan and then moving to Canada, I have seen the devastating effects of the war, conflict and poverty on those countries. And the Aga Khan Foundation and its institution, they were always there to help alleviate the suffering.
Ça doit faire environ 15 ans que je suis impliquée avec la Marche des partenaires depuis que j'ai déménagé au Canada. J'ai eu la chance de participer à des marches à Montréal, à Vancouver et aussi à Calgary.
In one of the years of the World Partnership Walk, we actually had special guests, including, I don't know if you can see clearly, I'll put it here, but that's a young me and that's a young Nabil, and that's somebody you might recognize. And he actually was there to give trophies, and we won the trophy for best school team, and that was definitely a memorable experience.
Well, being from a small Kane, the partnership walk was always a very big thing for our community to come together. I remember as a little kid being part of the car washes that we would do and bake sales. I remember going around to the teachers at my school to try and get them to donate. I also remember spending some nights with friends and family making crepes, so we could sell the crepes on the day of the walk with some delicious Nutella and get all the funds to go to the walks.
My most memorable moment was in 2018 when we were planning our Young Professionals networking event, and we were able to bring awareness to a local event, our walk, and we also had people volunteering for the day of the walk. These volunteers continuously sign up every year since 2018 and volunteer, whether it's part of the core team or on the day of the walk.
Growing up, I remember hearing this story, give a man a fish, you feed him for a day. Teach a man to fish, you feed him for a lifetime. And that really stuck with me. I think that probably stuck with you too. And that's really what we're doing here.
In 2016, I started organizing the Bruce Trail hikes in support of the World Partnership Walk. A group of about 25 of us would hike 50 kilometers over a 3-day period in support of the World Partnership Walk. We raised over $50,000 each year of the 4 years that we organized these hikes.
I know this year has been the COVID-19 crisis, but you will also get a lot of opportunities because we never had this many chance or opportunity to be at home and have plenty of time to give back. Giving awareness, just reading and understanding what walk is and how you could get involved.
I'm excited to participate in the Voyage this year and learn a little bit more about some of those initiatives. And I'm hoping that I can get my friends and family to watch this video together. And if we can't be physically together, maybe we can watch them at the same time from our own home and then have a little discussion, a debrief.
Definitely help out with the virtual program of the walk this year.
Yeah, I mean, just because it's virtual, nothing changes with the excitement level and the impact that it has, and we can't wait to be a part of it.
If you're looking to get involved, just donate to the Partnership Walk. Even if you get one new person on your team to join your team or donate, it makes a difference.
And finally, we're going to conclude this evening's episode with a sneak preview of what this virtual voyage will look like and how we're going to use all the marvels of digital technology to discover how AKFC is working with communities around the world to fight global poverty and to deal with the fallout of the COVID crisis that has engulfed the world. And don't worry, we're going to end with our traditional musical finale. In fact, I thought you might pretend that you're listening to the last performances on the World Partnership Walk stage as you sip mango lassi with one hand and sport your new World Partnership Walk t-shirt. I want to end by thanking you all for participating in tonight's program, and of course, for the leadership and dedication and commitment of the Canadian Jamaat to the World Partnership Walk and to the World Partnership Golf. These programs have become extraordinary institutions. They have not only provided support for our programming, they have enlisted thousands of Canadians outside the Jamaat, and in doing so have become really national movements. And that's something of which I think we should be very, very proud. And although we won't be together in person at these iconic locations across the country, we are confident that we will find a way to harness that same spirit, that same ethic that drives us every year to make a contribution to the world, and find it this year in this virtual voyage. And I look forward to your participation, to your support, and to your leadership as we deal with a difficult time in the world and the opportunities that it creates to contribute. Thank you. Good night.
The main aim of the outreach is to provide access of medical care to people who are not able to access the medical practice, or those who are not able to access facilities which sometimes are usually a bit far.
Enatara na irewa na utara uchapaka. Njisingu teba ngambia sengenjo. Mbuya serikali yagorete ikareta marioga yaiga abantu mbara kunya batari kwinyara batabwetsi besa bakuirira abana na nyagitari bana bagakonya abantu banyorende free.
Decidi ser uma enfermeira da área de saúde materno-infantil para salvar vidas das mães grávidas, assim como dos recém-nascidos.
بودم در رخصتی در بدخشان در یک هفته 3 زن از خاطر ولادت مرد. او مرا وادار به این کرد که من باید بخش نسای ولادی را خوب دقیق بخوانم، کار کنم و بعد بیایم در اینجا. اولین دکتر زن هستم که در بدخشان به حیث دکتر زن آمدیم و کار کردیم.
A child who dreams big turns to violence to survive.
Tuberculosis takes the life of a family, cause they couldn't afford a remedy. Hey, hey, open up your eyes and see the sky.
you're at. Take that chance and don't turn back. No, don't turn back. It's never too late to change. You place the blame, but hey, the days remain the same unless we're all in it. Push it beyond limits and live it till we got everybody involved with it, yeah. Seeking answers to a question never heard before, but in the end it turns out you're the answer you've been searching for.
Open up your eyes and see the sky. Open up your heart and clear your mind. Find the strength to stand tall. You could have it all. My faith will free me. I know it'll mend my soul. I know that love will heal me, and the smile of a stranger and the love of a friend will make me whole again. You gotta have faith. A world where we're not afraid to get along.
A day where we can dream together and sing as one.
A peaceful time, no war, poverty, yeah. When we forever can live in harmony, hey, hey, hey. Open up your eyes and see the sky. Open up your heart and clear your mind. Find the strength to stand tall. We can change it all. I know my faith will free me. I know it'll mend my soul.